Welcome to MED-MYSTIFY. Today, we are demystifying the world of anticoagulants with a visual explainer designed to make pharmacology clear and, most importantly, memorable. I am so incredibly excited to get into this topic today because, honestly, these are truly life-saving medications, yet their exact mechanisms and differences, they're frequently misunderstood. So, we're going to map out exactly how these drugs work, who they are for, and what to watch out for.
Okay, let's dive right into this by busting a massive myth straight off the bat. An anticoagulant is a drug that prevents the formation and extension of blood clots, which, as we know, are medically called thrombi. They do this by throwing a literal wrench into the body's natural coagulation cascade. But here's the absolutely critical part that a lot of people get wrong. They do not actually dissolve existing blood clots.
To make this super clear, I want you to think of a blood clot like a massive traffic jam. Anticoagulants, well, they act as the roadblocks that prevent new cars from entering the highway, effectively stopping the traffic jam from getting any worse. So they prevent new clots from forming or existing ones from extending. On the flip side, you have fibrinolytics or thrombolytics. Those act as the tow trucks that actually drive in and actively clear out the already formed crash. Today, we are focusing entirely on the roadblocks. Here is our roadmap for this explainer. First, categorizing the clot blockers. Second, Warfarin, the classic antagonist. Third, Anisindione, the synthetic alternative. Fourth, Clopidogrel, the platelet protector. And finally, number 5, comparing the big three.
Section 1. Categorizing the clot blockers, or the ABCs of anticoagulants.
So Group A covers our oral anticoagulants. These are the classic vitamin K antagonists, things like coumarin and 3-indinidone derivatives. Then, moving to Group B, this shifts to parenteral anticoagulants, meaning your injections and infusions. This features unfractionated heparin, low molecular weight heparins like enoxaparin, fondaparinux, and direct thrombin inhibitors. And finally, Group C. These are our antiplatelet drugs, where you're going to find everyday household names like aspirin, right alongside clopidogrel, prasugrel, and ticagrelor.
Section 2. Warfarin, the classic antagonist. This is profile number 1.
Sold under the well-known trade name Coumadin, this classic drug is an absolute staple in pharmacology. It falls right into that Group A category we just looked at. And its primary job is beautifully simple but vitally important: preventing blood clot formation and stopping existing clots from migrating to other parts of the body where they could cause, well, catastrophic damage.
So, the real takeaway here is that it's primarily used as a powerful preventative tool, or prophylaxis. It treats venous thrombosis, pulmonary embolisms, which is, of course, when a clot travels to the lungs, and it manages atrial fibrillation with embolization. It's also vital for preventing systemic embolisms after a patient has suffered a myocardial infarction, which is a heart attack.
However, as we know, managing warfarin isn't always easy. Its side effect profile is pretty extensive. Patients might experience general discomforts, abdominal pain, diarrhea, headaches, dizziness, but it can also present much more surprising effects like blurred vision, skin rash, muscle or joint pain, and even hair loss or thinning. And most importantly, patients absolutely must monitor for severe markers like blood in the urine or stools or yellowing of the skin and eyes. Those require immediate medical attention.
Section 3. Anisindione, the synthetic alternative. Profile number 2. Sold under the trade name Miradon, anisindione is a synthetic anticoagulant. Specifically, it's an indandione derivative. Now, while it operates in that exact same overarching oral anticoagulant category as warfarin, its synthetic nature gives it a pretty unique pharmacological identity.
Anisindione triggers a fascinating 3-step domino effect right in the liver. Step 1, it inhibits vitamin K-mediated carboxylation of precursor proteins. Step 2, because of that initial inhibition, it literally stops the formation of active procoagulation factors II, VI, IX, and X, as well as those anticoagulant proteins C and S. And finally, Step 3, without those active factors, the entire coagulation cascade is successfully prevented. Basically, no cascade, no clot.
Much like our previous drug, Anisindione is utilized to treat venous thrombosis, pulmonary embolisms, AFib, and as an adjunct for treating coronary occlusion. But you really have to look closely at its side effect profile.
While it shares some similarities with warfarin, like the nausea, the diarrhea, and the hair loss, it uniquely includes things like fever, hives, and mouth sores. So if you're managing a patient on Meridon, they have a very specific, visible set of warning signs to monitor for daily.
Section 4. Clopidogrel, the platelet protector. Profile number 3. Unlike the previous two drugs, which act on the coagulation cascade factors in the liver, Clopidogrel, widely known by the trade names Plavix or Iscover, works directly on the platelets themselves. It has a structure and activity similar to ticlopidin. But here is the really fascinating part about it. It's actually a prodrug. That means when you take it, it's completely inactive until your body converts it into an active metabolite. Once it's converted, it goes straight to work irreversibly blocking specific P2Y12 ADP receptors right on your platelets.
And because it stops platelets from clumping together, clopidogrel acts as an essential, life-saving shield for patients suffering from atherosclerosis. It's specifically used to actively decrease their risk of subsequent atherosclerotic events, which essentially means lowering the chances of suffering a future heart attack, stroke, or vascular death, particularly for patients who already have a documented recent stroke, recent MI, or established peripheral arterial disease.
Of course, altering platelet function carries distinct risks. Some are internal, like a sudden change in taste, diarrhea, loss of appetite, joint pain, and headaches, while others are highly visible. Think redness of the skin, white patches in the mouth or on the tongue, difficulty breathing, and pretty predictably for an antiplatelet, sudden nosebleeds.
Section 5. Comparing the Big Three. The ultimate cheat sheet.
Now this comparison right here is the ultimate study guide, perfectly contrasting the nuances we just learned. Notice the drug class differences first. Warfarin and Anisindione are both your traditional anticoagulants, whereas Clopidogrel is an antiplatelet. Moving over to the main target, Warfarin focuses on vitamin K recycling, while Anisindione targets vitamin K-dependent factor synthesis. Yet, despite those slight differences in their targets, notice that their final effect is exactly the same, a decrease in factors 2, 7, 9, and X. Contrast that with Clopidogrel down at the bottom, which targets the ADP receptor to achieve its final effect, which is lowering overall platelet aggregation.
Considering the extensive side effects we just mapped out, how do medical professionals perfectly balance the life-saving prevention of clots against the ever-present risks of bleeding? It is a delicate, incredible science for sure. Kindly like, subscribe, and share this with your friends for such more pharmacy-related informative videos. Be sure to write your questions, suggestions, and thoughts in the comment section. We will catch you in next one.